Now it is my great honor to introduce Dr. Rakesh Kumar Sharma, distinguished Ayurveda doctor, associate professor and former head of department at the Postgraduate Institute of Ayurveda, editor-in-chief of the International Journal of Research in Ayush. Please welcome, the floor is yours.
Very good evening. I think everybody is waiting for the cruise now. Now, I think I should finish in time so that we should not be late in cruising again in the evening. So, I would like to finish in time. We have been listening so many things since morning, and regarding Ayurveda, acupuncture, and so many different streams of medicine, philosophical aspects of Ayurvedic medicine, and many, many more. And we have seen so many inspirations here in abroad who has been working, who has been practicing different systems of medicine, and those are the inspirations for the new generations. As I just talked to Mr. Kiran Vyasji, and all these persons, they have brought a new enlightenment to these therapies towards the globe. And similarly, we in India, now, so far I'm discussing about a new therapy which is emerging in India right now. That is Marma therapy. Hopefully, a day will come, then this will also be a globalized therapy. And this is Marma therapy. Marma actually, Introduction, Marma therapy. An ancient healing modality based on Ayurveda revolves around the stimulation and protection of certain centers of vital energy known as Marma. They are sites where the muscles, veins, ligaments, bones, and joints intersect and are considered to be the centers of the vital life force. Actually, vital life force is known as prana. You must be aware of the word prana, I think so. If you see, you have been in touch with the Ayurveda practitioners, and usually, and some spiritual persons from Indian side, and you would have heard about prana. Prana means the life energy, the vital source, vital force. So vital life force with more than 107 points recognized on the human body. In our Sushruta Samhita, he is the father of surgery, he is known as father of surgery. He has pointed out 107 vital points in the body. And these Marma points are scattered around the body, and these have different phenomena. I will be discussing in later slide. This therapy holds a central position in Ayurvedic diagnostic and therapeutic procedures. The historical origins, anatomical importance, physiological impacts, therapeutic uses, and modern-day application of aromatherapy, linking traditional Ayurveda wisdom with scientific investigation today. So, if we discuss Marma therapy, it is supposed to be that if you are having 107 vital points in the body, it means these are the points where the energy or vital force is stored. These can be used for the protection of the human beings in relation to wars or some fighting instances. In such conditions, we have to, or for surgical intersections, we have to preserve for these points. But on the contrary, now onwards, this has been found that we can use this point for the preservance of preserving the human health, for preserving the human illness, for preserving the human fitness from the illnesses nowadays. So, in this context, Ayurveda, the ancient medicine system, is based on a philosophy of health that unifies body, mind, and spirit. Among many of its therapeutic modalities, Marma Chikitsa or Marma therapy holds a strategic position because of its subtle yet profound impact on the body's vital processes. Marma comes from the Sanskrit root mri, meaning to kill. That I earlier said the vital force, which is related to the prana or vital force, that is, which is supposed to kill a person or to harm him in extreme manner. So I will be discussing the later terms in this regard, describing the sensitive and vital character of these points. Marma therapy is the manipulation of these points to facilitate healing, balance energy, and restore the homeostasis. Because all the therapies has the single motto that homeostasis should be maintained, and in Ayurveda we say the sattvic sthiti should be maintained. Next. This is again, marmas are the site. This is the quotation from the text. Marmas are the site where the muscles, mans means muscles. So muscles, muscular body is made up of all these 5 parts. Muscles, veins, ligaments, bones, and joints. All these points are considered to be centers of the vital force. Understanding Marma points. Ancient definition, Marma derives from the Sanskrit root mri, meaning to kill, highlighting these points' vital and sensitive nature. They represent intersections where muscle, veins, ligaments, bones, and joints converge. Vital energy, these 10 recognized points serve as centers of prana, playing crucial roles in early diagnosis and therapeutic interventions throughout the body. Historical foundation, ancient texts documented in Sushru Samhita, Ashtang Hriday, and Charak Samhita. These are the 2 texts, basic texts of Ayurveda. Third one is Ashtang Sangya also, but these 2 are the more renowned texts, and as a fundamental knowledge. Second one, this was used as I earlier said, that it was used as a military medicine, initially recognized for trauma consequences and warfare, later developed for therapeutic healing applications. Surgical innovation, Sushruta, father of surgery, systematically classified points by location, structure, and clinical significance of these points. And now, modern integration is that contemporary research validates ancient wisdom through neurophysiology and anatomical correlations of these Marma points. Structural classifications. Now, if we see that, how do we find these? These 10 have been classified in different structural ways. Though we find total these are total 107. From every angle we find that these are total 107. If we see from the structural classification, that is 41 vascular points are there in the body, located at major blood vessel intersections, influencing circulations and cardiovascular function. Snayu Marma, that is 27 ligament or tendon points, positioned at tendon ligament junctions, affecting musculoskeletal stability and movement. Sandhi Marma, these are the 20 joint Marma. Sandhi means joint. Concentrated at joint interfaces, impacting mobility and the structural integrity. And then Mans Marma, that are the 11 muscular points. These are embedded within the muscle tissue, regulating strength and muscular coordination. And Asthi Marma, 8 skeletal points aligned with the bone structures, influencing skeletal health and structural support. This was the structural classification. Classification based on the effect of injury or prognostic basis, how we can identify them. Sadhya Pranharma. Sadhya means immediately fatal. Supposed to be, and immediately has been defined as in between 1 to 7 days. Not immediately, maybe some particular injury may cause death to immediate, and some may cause in between 7 days. If it causes death in 7 days, it is fatal in 7 days. That it is supposed to be Sadhya Pranhar or immediately fatal. And these are total 19. Then Kalantar Pranharma, that is fatal after some time. Then these are 33. Then Vishalyakan, fatal if the foreign body is removed, that is 03. If we have one foreign body hit in the body, and if you are not pulling it out, you can survive. If you are pulling it out, it means extreme of blood will be poured out, and this way a person can succumb to death. So these are the only three vital points are supposed to be Vishalagna Varmas. And then 44 are the Vakalyakar. Vakalyakar means to make one handicapped, disabled. Injury leads to deformity or disability. On the injury to these marmas, person can be a handicapped, have handicapped disability in himself. And Rujakarmas are 8. Injury causes severe pain. As we see, particularly one Marma is there, Rujakarmas. As we see this one particular, if we find, if we hit on this month, we have profound, we may have found profound pain on these Marmas. Shakhagat, that is supposed to be the regional extremities. Now it is the region wise, how these are defined. Total 44 means 11 in each extremity. Total 4 extremities are there. In this way, these are 44 marmas in the body. And in between the trunk, that is complete back, thorax and abdomen, these are total 44, and the Urdu Sharir, that is 33. And 14 and 33. So this way, I have, this may have been missed. 14 and 33, this way, these are total 107 marmas there. Modern scientific correlations, if we see, neurological alignment. Marma points correspond closely with peripheral nerve junctions and major neural pathways, explaining their profound physiological aspects. You know, whole body is controlled by the nervous system, and everywhere there is nervous interception. So this way, this controls, if we press on the these particular marmas, this is going to reflect the reflect in a result. Vascular correction points align with large blood vessels and lymphatic drainage sites, supporting circulation, proper circulation and detoxification mechanisms. Myofascial interface, strategic positioning at muscle tender interfaces enables effective myofascial release and the tension reduction. Similarly, therapeutic mechanisms, that is neurohumoral modulation, regulates neurotransmitters including serotonin and dopamine influencing mood and the pain perception. Then energy regulation, optimizes prana flow through srotas, body channels. Srotas are supposed to be the body channels. We in Ayurveda have different terminology. We have some specific terms, some specific aspects. This is, out of them, srotas is also one of them. And these are supposed to be the body channels. And optimizes prana flow, vital sports flow through these srotas, these body channels, restoring the energetic balance and the vitality. Reflex response stimulates neural reflex arcs that influence internal organ functions and autonomic responses. If we are going to press particular organ, this is certainly going to some targeted area and will reflect upon that area and will give the required results. Myofascial releases facial tension and muscular restrictions, improving mobility and reducing pain. Clinical applications, neurological conditions, these are the post-stroke rehabilitation support, sleep disorder management, stress and anxiety reduction, cognitive enhancement, then musculoskeletal disorders, chronic pain management, joint mobility improvement, sports injury recovery, and postural correction. Then clinical practice guidelines, what to do and what not to do. Environmental preparation, create calm, healing space, conducive to relaxation and therapeutic focus. There should be such type of environment so that the patient get relaxation, get relaxed, and be relieved of the problems properly. Point identification, precise anatomical location using traditional landmarks and modern anatomical knowledge. It is must that we should be aware of the point where we have to press and from where the energy forces, vital forces are flowing through. Another one, gentle manipulation, apply circular motions, light pressure, gentle tapping with therapeutic intention. Then individual assessment, customized approach based on constitution, dosha imbalance. Dosha are the humors we find in our body. This is our concept, Vata, Pitta, Kapha. It's a broad subject. You would have been in touch in different sections and different lectures as well. So customized approach based on the constitutional dosha imbalances and specific health concerns, and safety protocols exercise extreme caution with Sadhya Pran Marma points requiring specialized training. As far as the points which are the immediately fatal points, there we have to take special concern of these points, and pressures should be given with a proper protocol over there, with a proper training as well. So important, seek qualified practitioner guidance before attempting Marma therapy to ensure safety and therapeutic effectiveness. It is necessary that one should be well trained and should have well expertise in the subject and the therapy, and he should only be chosen for this practice. Future directions, research integration, combining traditional Ayurvedic wisdom with advanced biomedical instrumentation for comprehensive validation, protocol standardization, developing evidence-based guidelines for technique, pressure levels, and treatment duration, professional training, establishing certification programs for qualified practitioners in integrative healthcare settings. Marma therapy represents a sophisticated energy medicine system with significant potential for modern integrative healthcare. Bridging ancient wisdom with contemporary scientific validation will unlock its full therapeutic capabilities. So these were the presentation, and these are some cases where actually some students are undergoing post-graduation in my, as I am from Dr. Sarapalli Radhakrishnan, Rajasthan Ayurveda University in Rajasthan, Jodhpur. So in post-graduation department, some students are undergoing research on these particular subjects, and this is the point where Marma therapy is given in insomnia and Shankh Marma. Another Miss Chanchal, a 22-year-old female has been experiencing sleep disturbances for the last 3 months. She reported difficulty in initiating sleep induction problem along with frequent awakenings during the night and early morning awakening. Due to these disturbances, she has been unable to achieve restorative sleep. She complained of not feeling refreshed on waking with daytime sleepiness and a sense of general unwellness throughout the day, which affected her concentration and daily activities. On assessment, her Athens insomnia scale AIS score was 16, indicating clinically significant insomnia. She came to the clinic seeking management through Marma stimulation therapy. We have established a Marma therapy clinic in our university, and patients are coming over there. This is the another aspect where a case of Vat Kantak, a problem, healing pain, calcaneal pain, yes. Then image number 3, cases of cervical spondylosis. Then image number 4, case of frozen shoulder. And image number 5, case of lumbar spondylosis. These are the examples. Image number 6, case of knee joint pain. So this is what Marma therapy is. It's a long to be discussed. I have just introduced this one to all of you. Maybe you may be knowing this one, but this is a new therapy, and we are practicing upon it. And throughout, for the last 20 to 25 years, this has started developing in India, and now we are practicing it, and a validation, scientific validation of these points, these are under progress, and we are working upon it in different research studies, and hopefully one day will come that this therapy will be another stream for the well-being of the humanity. Thank you very much. I think I would not have taken much time, and because otherwise it would have been another point to injure your injure your time.
Thank you so much, Dr. Sharma. Thank you so much, Dr. Sharma, for your inspiring lecture.